Hi guys, my name is Sanjay Gupta. I'm a consultant cardiologist in New York, and today I wanted to do a video on the subject of cardiomyopathy. A lot of people have written to me and said, could you do a little video on cardiomyopathy so we understand it? So I thought I'd do a quick video just to talk to you about cardiomyopathies. Okay, so the first thing to try and understand is, what does the word cardiomyopathy mean? Cardio, heart; myo, muscle; pathy, meaning disease. Okay, so it's an abnormality or a disease of the muscle of the heart. And to try and make this very easy, what I've done is I've acquired a model of the heart here. Okay, so what you have to understand is, when we're talking about cardiomyopathy, the heart is a muscle. All right, so when you open the heart up, this chamber here, you see there are 4 chambers. There's one chamber here, there's another chamber here, okay, and then on top there are these 2 chambers here, and between this chamber and this chamber there's a valve called the mitral valve, and between this chamber and this chamber there's a valve called the tricuspid valve. So here you have the left heart, the big muscular heart; here you have the right heart. All right, and as you can see, this is all muscle. The heart is a muscle. All right, now because the left heart, this chamber, is pumping blood through this blood vessel called the aorta, and through this the blood goes all around the body. All right, so the blood goes to the head over here, and then this continues all around the body. And when we feel our pulse in our wrist or in our groin, then we're actually feeling a vessel which is in direct continuation with this big vessel. All right, so this is called the artery. The reason it's red is because arteries take oxygen away from the heart and supply all the vital organs with oxygen. Now, the heart muscle itself needs blood as well. So the heart is this pump, it's pumping all this blood out. But you'd say, well, how does this pump keep going? And the answer is that when the blood is pumped out into this vessel, all right, then you have small vessels here. You see over here, there's a small thing, this little red dot here. These are all small blood vessels, one here, and these blood vessels supply the heart muscle. So you can see that if I put the cover on there like this, God, there you go, there you go. So if I put the cover in like this, you can see that these blood vessels here supply this muscle, and that's why the muscle looks red, because it's getting all this lovely blood that the heart is squeezing out. It's squeezing it out this way, but it's also squeezing some back in to supply itself. So the heart, not only does it pump blood around the body, it pumps blood around itself, around the muscle itself, and these are the heart arteries, okay, and the blue ones are the veins. So the heart gets oxygen, and then the veins take away the deoxygenated blood, which is blue blood. All right, so when you're talking about a cardiomyopathy, what you're saying is that this muscle here, all right, all this muscle is in some way diseased. All right, can you see that? This muscle is diseased. Now the question is, how can this muscle be diseased? So cardiomyopathy, all it means is a disease of the heart muscle. All right, you have to then try and work out, how did this disease happen? What has caused this disease to happen? What has caused damage or disease in the heart muscle? The obvious reason people get cardiomyopathy is because if, for example, you had furring up in one of these blood vessels, all right, or you have a blockage here, then that part of the heart muscle, which would be expecting this beautiful oxygen-rich blood to supply the vital sort of cells over here, will die. If you don't get good blood down this vessel because the vessel blocks off, that part of the heart dies. So in essence, what will happen is a part of the heart muscle will die. All right, and that is what a heart attack is. A heart attack is when you get furring up of these tiny, what look like tiny blood vessels here. All right, and if one of these blocks off, that causes a heart attack, and that part of the heart muscle then dies. When that part of the heart muscle dies, what happens? The heart obviously is not going to pump as strongly as it would if all the heart muscle was working, because now you have a bit of scar over here, and therefore this scar is not going to function. So less heart muscle to do the same job. Because less heart muscle is trying to push the blood out, eventually what happens is less blood comes out because there's less heart muscle trying to do the work. And because there's less blood that comes out, what happens is less blood goes to the kidneys from here. So less blood is going up here, going to the kidneys, and the kidneys will think you're dehydrated, because the kidneys are very sensitive. If they're not getting the blood that they need, their first job is to try and absorb more water from the urine to try and restore the circulating amount of blood in the body. So what happens there is that the kidneys start absorbing more water. The water helps restore the volume of blood in the body. And so now what happens is you have a lot more blood coming back. But again, this part is not moving because it's dead because of the heart attack. And therefore, again, when the heart contracts, less blood goes out. Again, the kidneys get less blood. Again, they absorb more. And so as time progresses, more and more blood keeps coming into this muscle, into this chamber. But actually, the chamber can only do so much. It can't pump more blood out because it's weak. And so finally what ends up happening is that the chamber starts getting bigger and bigger because there's more and more blood that keeps coming back into the chamber, because the kidneys are absorbing all this blood because they think, oh, this person is dehydrated. So they absorb more and more water from the urine. They try and restore the circulating volume, and eventually you develop a condition where you get more and more and more blood, and the chamber gets bigger and bigger. Now, these walls are generally quite elastic in that if you stretch them initially, they come back stronger. So the heart relaxes, and the more you make it relax or the more you stretch it, the more strongly it contracts. But at some point, what happens is that you stretch it so much that it loses its elasticity and it will not come back. And therefore, the heart becomes big and it becomes weak because it's lost its elasticity, it's lost the ability to pump, and therefore you develop a weak heart. And that is the mechanism for ischemic cardiomyopathy. That is one of the commonest reasons why people who have had heart attacks later on come and have heart failure or are found to have heart failure. Heart failure meaning that the heart fails to keep up with the body's requirements, all right? It's a horrible term, but that's all it means. It means that the heart is failing to keep up with the body's requirements. So that is ischemic cardiomyopathy, because the cardiomyopathy has been caused by ischemia, or i.e. a suffocation of the heart muscle because of a blockage of the heart artery, all right? So that's ischemic cardiomyopathy. Another form of cardiomyopathy, another form of cardiomyopathy is, for example, if you have a leaky valve. So you've been equipped with the valves over here, all right? There's one valve over here, as you can see. And then actually, if you look over here, there's another valve, all right? And this valve is called the aortic valve. This valve is called the mitral valve. So the blood comes in through the mitral valve into the left ventricle and then gets pumped into the aorta, and there is this aortic valve which sits there. Now, imagine if one of these valves was leaky, what would happen? So the heart is pumping blood, all right? But actually this valve is leaky, so instead of all the blood going this way through this valve, some blood goes back into this chamber. So you have the same problem. Less blood goes to the kidneys think you're dehydrated, they start absorbing more and more volume, absorbing more and more fluid from the urine. That results in more blood eventually circulating around. More blood comes into the left ventricle pumps again, but again, it's not, some of it will leak back. So again, less blood goes to the kidneys get into this vicious cycle, and eventually the heart starts filling up and gets bigger and bigger because there's more and more and more blood, and eventually the heart loses its contractility because you've stretched the fibers too much, so they've lost their elasticity, and the heart becomes weak and flabby. Now, in this case, if there's a valve that's caused it, a leaky valve, then that's called a valvular cardiomyopathy, all right? Now, what other types of cardiomyopathy can do this? Alcohol in excess can be extremely dangerous, because if you're drinking a lot of alcohol for over a number of years, alcohol is toxic to the heart muscle cells, okay, these cells, and therefore if you're drinking a ton of alcohol, the heart muscle cells will start weakening. Because they start weakening, less blood goes out of the heart, the kidneys get less blood, and you get again into this vicious cycle. And that is called an alcohol-induced cardiomyopathy. So that's the third type of cardiomyopathy, where alcohol induces it. Are there anything else that can cause it? Well, there can be. Sometimes you can get viruses, so you can get a bad viral infection, and if you get that, then sometimes the heart muscle can be affected. So myocarditis, an inflammation of the heart muscle cells with a virus, can cause the heart to weaken. Again, you get into the same cycle, and the heart will get weaker. Anything else? Sometimes you can have this with stress. Extreme stress can do this as well. So in extreme stress, something called stress-induced cardiomyopathy, again, extreme levels of stress, extreme levels of adrenaline and cortisol and all those horrid stress hormones can cause transient weakness of the heart muscle, and that's called a stress cardiomyopathy. Sometimes you may not have any obvious explanation, all right? And in those people, when you don't have any explanation, you just define the cardiomyopathy with what it has caused. And basically, most of these cardiomyopathies result in the heart getting bigger and bigger, i.e. the heart is dilated. So some people then call them idiopathic, i.e. there is no obviously identifiable cause that we know of, dilated cardiomyopathy, all right? So those are the different types of cardiomyopathy to know about. There is a different kind of cardiomyopathy as well, okay? All the ones I've talked to you about so far cause dilatation of the left ventricle. The ventricle gets bigger and bigger and bigger, loses its contractility, gets weaker and weaker. Those are all forms of dilated cardiomyopathy. There is a different form of cardiomyopathy, which is called hypertrophic cardiomyopathy. Now, imagine what happens here if this heart muscle is having to work much harder. Let's assume I put a tight band around this blood vessel here, all right? If I put a tight band, now the left ventricle is having to contract, it's trying to pump into this big red vessel, but if I put a tight band around it, it's not going to be able to pump blood through that tight band as easily. And therefore, the left ventricle, this muscle, has to work harder and harder over a period of time, over several years, to try and get this blood to go through this narrowing, all right? And as it does so, it becomes more muscular. And because it becomes more muscular, the heart muscle starts thickening up. And that is called hypertrophy, because the heart muscle is beginning to thicken up. When the heart muscle begins to thicken up, there are two important things that happen, all right? The first thing is, although the heart muscle, because it's more muscular, you think it's stronger, it's doing the job, it's still getting the blood to the kidneys. It is, but very muscular hearts, if they become very muscular, are very good in the sense that they contract well, but they don't relax as well. So although this heart muscle will contract because it's more muscular and push the blood out, when it comes to relaxing, it doesn't relax so quickly. And because it doesn't relax so quickly, what happens? It fills with less blood. So again, you get into the same vicious cycle. Less blood is going out of the heart because the heart muscle has become so thickened that it's become stiff and it isn't relaxing, so it's filling with less blood. And because it's filling with less blood, it's pushing less blood out. And if it's pushing less blood out, then again, you get into this vicious cycle. The kidneys get less blood. The kidneys think, oh, this person's dehydrated. And slowly and gradually, what starts happening is eventually this heart muscle starts becoming weaker because the load on the heart is greater. The second problem with left ventricular hypertrophy of a hypertrophic cardiomyopathy is that after, you see, this muscle is being supplied by these blood vessels here, as I've shown you earlier. Okay, so these blood vessels are supplying this muscle. Now, if the muscle gets too big or too thickened, then it will outstrip its blood supply. So you don't have enough blood getting to all this muscle. And therefore, there will become parts of the muscle which will become devoid or suffocate because of a shortage of blood. And paradoxically, the heart muscle will then start to weaken. Okay, so that's the other problem with a hypertrophic cardiomyopathy. Causes of a hypertrophic cardiomyopathy, well, the most common cause is high blood pressure. So as I'd said, if you put a band around here, for example, around this bit, this red bit here, then the heart has to work much harder. High blood pressure is similar because what it means is that there is a higher pressure in this blood vessel, so the heart has to work harder. All right, so the small blood vessels, which these all, eventually this will go on and become join tributaries and leaf branches and the smaller branches. But if the smaller branches start getting narrowed, which happens at high blood pressure, overall, there is a much higher pressure in this vessel, and that causes this hypertrophy. Another thing that can do it is something called coarctation of the aorta. Some people have this defect where they have a tight narrowing of this blood vessel, all right? And if they have that, then they get left ventricular hypertrophy. Another thing is aortic stenosis. So as you may remember, I showed you that there is this valve through which the blood goes. The valve sits there because it's stopping the blood from falling back into the heart when the heart is contracted. But that can get tight with wear and tear. If it gets tight with wear and tear, or it can be abnormal to start off with, then that will cause hypertrophy of the left ventricle. Sometimes you can be born with a genetic defect where this muscle is generally just defective. So it becomes very thick because you have a mutation and the muscle becomes very thick. Again, of course, the problems with that are twofold. One, it will do the same things that I talked to. It causes a stiff heart. It can outstrip its blood supply. But also, and perhaps more sinister, is the fact that because there's abnormal muscle, it can play havoc with the electrics. And that condition where you've inherited a mutation in your body, which causes this heart muscle to thicken, is called hypertrophic cardiomyopathy. And hypertrophic cardiomyopathy, in particularly in a subset of patients, can be quite dangerous because it can predispose them to heart rhythm disturbances. So if you do have a first-degree relative who has hypertrophic cardiomyopathy, it's very important that you have an echocardiogram, a heart scan, where someone can look at the thickness of this muscle and make sure it's not unduly thick. A few more things to talk about. There is another condition called amyloidosis, okay, or Fabry's disease. In these diseases, you can get deposition of abnormal tissue in this heart muscle, and that causes the heart to be abnormally thickened, and paradoxically, the heart gets weaker. So those are the different causes of cardiomyopathy, and it's important when you are told that someone in your family has had a cardiomyopathy that you ask them, was it a dilated cardiomyopathy, i.e., was it because the heart was getting bigger and bigger, or was it a hypertrophic cardiomyopathy? Okay, and then you should try and say, well, what was the cause of that cardiomyopathy? Because that tells you a lot more than just the word cardiomyopathy. So I hope this was helpful. At some point, I'll do a video on trying to understand how to treat cardiomyopathy, but this is just a little bit about cardiomyopathy. So if you enjoyed this video, please consider subscribing to my channel. Poor Jeanette, I can't give you her phone number anymore because she's asked me not to, but you can get in touch with me on my website, just there, and my Facebook page, there. And my name is Sanjay Gupta. I'm very grateful for all the amazing messages you leave me. I am so grateful for all the great feedback, and it gives me a lot of encouragement, and I'll keep putting out some videos for you. So please don't hesitate, get in touch with me, let me know what videos you want me to put out, and I'll try to do my best. So all the best, take care, bye.